For my disease presentation, I have chosen to do muscular dystrophy. So, muscular dystrophy is a group of diseases that cause weakness of muscle mass. There are so many types of different muscular dystrophy. So, just to talk about a few, there's Steiner's disease. So, this is the ability for you to relax your muscles on your own. They kind of do their own thing. This form of muscular dystrophy is most common in adult onset muscular dystrophy. There's FSHD, which is muscle weakness in your face and your shoulders. Um, this normally begins in your teens, and that's where it's most commonly found. But there have been some cases where they found it in children, and they've even found it in adults as old as 40. So it can vary. And then there's limb and girdle. This affects your hips and your shoulder muscles. So people who have this tend to frequently fall just because their hip muscles are affected. And so they have issues raising the tops of their feet up, which obviously causes them to fall. This is found mostly in children and in teenagers. So some symptoms for muscular dystrophy include falling frequently, having issues getting up from sitting or laying down, trouble with running or jumping, walking on your toes, having large calf muscles, having muscle pain or stiffness, and learning disabilities are all different symptoms you can have with muscular dystrophy. So, the way that muscular dystrophy actually occurs is you have a gene, and it is involved in making proteins that protect your muscle fibers. So, when that gene is damaged or it's defective, that is what causes muscular dystrophy. So, this can be genetic, it can be passed down, or it can be just a random thing that happens and it occurs when it's random. It's either it happens in the mother's egg before fertilization, or it happens in a developing fetus. So some risk factors include having trouble walking, depending on what form you have, the shortening of your muscles or your tendons right around your joints, breathing problems if your lungs are affected at all, scoliosis, which is just your spine curving, heart problems if muscular dystrophy gets into the muscles in your heart, and swelling problems if the muscles in your throat are affected at all. So there are multiple ways for your doctor to diagnose you with muscle dystrophy. So obviously they'll look at your medical history and do a physical first, but then they can perform enzyme tests, which is just taking a sample of your blood and testing for CK levels. So high counts of a CK level in a healthy person who hasn't experienced a recent trauma suggests that you have a muscle disease. An echomyography is used to detect electrical activity in your muscles. So if you have a frequent change in your electrical activity, that confirms that you have a muscle disease. They can do genetic testing, which just tests your blood for mutations, or they can perform a muscle biopsy. So they just go in and take a small piece of your muscle, a tiny piece actually, and they just analyze it to look for the mutation. There currently is no cure for muscular dystrophy. However, there are multiple treatments you can try to prevent or reduce problems you might have. So you can take medications, you can take corticosteroids and ACE inhibitors or beta blockers. The last two are used mostly for if your heart is damaged. You can do therapy, anything like exercising, wearing braces, or using mobility aids can help a lot with those who have muscular dystrophy. And then surgery can also be an option. If you have scoliosis and you need a spinal correction, you can go to have surgery to have your spine fixed. You can have surgery to help with any muscle shortening you have, or you can go and have surgery if you have cardiac issues. So outcomes for muscular dystrophy greatly varies. So some people, depending on what form they have, can have a very slow progressing disease and they can live a normal life. And others will have a fast acting disease and won't be able to walk by the time they're in their 20s. And it also varies in children as well. Um, Children that are diagnosed with this can either die in infancy or they can have the slow progressing form, which leads them to live into their adulthood lives with a disease. So it just depends on the person and the type of muscular dystrophy that they develop. So all of the links for that I used are cited down